Welcome to Sarah Podcast. Today we are looking at health and safety in organizations. This session will cover the legal framework, policies, responsibilities, elements of health and safety management systems, and safety culture. By the end, you will have a thorough understanding of creating and maintaining safe working environment. Let's begin. Section 1. The legal framework of occupational health and safety in Ghana. Government policy on organizational health and safety. Ghana lacks a universal occupational health and safety policy. However, various acts outlines safety requirements. Developing a national policy would 1. Affirm government commitment to workplace safety. 2. Prevent accidents, injuries, and diseases. 3. Promote healthy work environment and boost productivity. 4. Ensure employer compliance. Key features of National Organizational Health and Safety Policy. 1. Active participation of employers, employees, organizations, and the government. 2. Mobilization of institutional and financial resources. 3. Proper coordination among institutions. 4. Periodic reviews and evaluations for continuous improvement. Section 2. Key acts relating to organizational health and safety in Ghana. 1. Workmen's Compensation Act 1987 PNDCL 187 ensures compensation for workplace injuries or illness, except in cases of intoxication. 2. Persons with Disability Act 2006, Act 715, mandates employers to provide tools and facilities for workers with disabilities. 3. Factories, Offices and Shop Act 1970, Act 328, covers workplace cleanliness, ventilation, first aid, and accident reporting. 4. Civil Liability Act 1963, Act 176, holds employers liable for negligence causing harm. 5. Labor Act 2003, Act 651, specifies employer obligations, including providing safe workplace and safety equipment. Section 3. Why institute policy on health and safety? Why institute a health and safety policy? 1. Establishes clear organizational health and safety aims and objectives. 2. Reduces risks and enhances organizational performance. 3. Demonstrates management commitment to stakeholders. 4. Satisfies legal requirements. Section 4. Elements of health and safety management systems. An effective health and safety management system is key to minimizing workplace hazards. Its core elements include 1. Planning phase. Develop a policy statement outlining management commitment, identify hazards and set safety goals. Establish emergency procedures and safety standards. Assign health and safety responsibilities at all levels. 2. Performance phase. Foster effective communication across the organization. Encourage employee participation and safety initiatives. Monitor ongoing activities to ensure compliance and improvement. 3. Performance assessment phase. Use active methods like inspection and risk reviews. Utilize reactive methods like accident and near miss analysis. Regularly evaluate whether safety goals are being met. 4. Performance improvement phase. Review safety targets and address shortcomings. Ensure resources and supervision levels are adequate. Commit to continuous improvement, proactively addressing safety concerns. Section 5. Features of health and safety policy. 1. Support from top management. Policies must have backing from senior leaders. 2. Stakeholder involvement. Reflect participation from managers, employees, and supervisors. 3. Clear roles and responsibilities. State duties for all individuals. 4. Accessible language. Ensure policies are easy to understand. 5. Visibility. Display policies prominently in the workplace. 6. Periodic reviews. Update policies to align with best practices and evolving conditions. Section 6. Organization and arrangements for health and safety. Organization of health and safety. Assign responsibilities for safety across departments. Specify names, roles, and duties. Arrangements for health and safety. Accident reporting. Define procedures for reporting and investigating incidents. Emergency procedures. Include first aid and disaster response protocols. Protective equipment. Detail usage of personal protective equipment. Welfare facilities. Ensure provision of restrooms, clean water, and break areas. Section 7. Responsibilities and rights at the workplace. Employer responsibilities. 1. Provide safe machinery and working methods. 2. Prevent exposure to harmful substances. 3. Offer training and welfare facilities. 4. Supply protective equipment free of charge. 5. Prepare for emergencies with first aid plans. Employee responsibilities. 1. Take personal responsibility for safety. 2. Follow health and safety instructions. 3. Properly use protective devices. 4. Report accidents and hazards. Employee rights. 1. Refuse unsafe work that threatens life or health. 2. Request hazard investigations. 3. Access workplace safety information. 4. Elect health and safety representatives. Section 8. Defining health and safety culture. Defined as their collective values, attitudes, and behavior influencing an organization's commitment to safety. I'll take it again. Health and safety culture. Defined as the collective values, attitudes, and behaviors influencing an organization's commitment to safety. Reflect how employees feel about safety, what they do, and the policies in place. Positive health and safety culture encourages proactive risk management, promotes leadership commitment to safety, includes detailed risk assessment and control systems. Key indicators of positive culture. 1. Promote investigation and reporting of accidents. 2. Effective communication of safety objectives. 3. Regular employee training. 4. High standards of equipment monitoring. Section 9. Indicators of poor health and safety culture. High absenteeism and accidents. 2. Lack of resources for effective management. 3. Decisions prioritizing costs over safety. 4. Poor communication and compliance with safety rules. Section 10. Factors affecting health and safety culture. 1. Management commitment. Leadership sets the tone for safety priorities. 2. Job security. Affect employees' attitudes towards safety. 3. Supervision levels. Ensures adherence to safety practices. 4. Training access. Provide employees with necessary knowledge. 5. Employee involvement. Encourage participation in safety decisions. In conclusion, Maintaining workplace health and safety requires robust policies, proactive management, and a culture that prioritizes well being. By integrating the elements of health and safety management systems, organizations can ensure safer environment and enhance productivity. Thank you for your attention. This is Sarid Podcast.